Kaleidoscope, a weekly public affairs program brought to you in partnership with the Urban League of Greater Cleveland, Kaleidoscope Magazine, and News Channel 5.
Good morning, everyone, and glad to have you with us today. Any time is a good time to get your personal finances in order. I hope you agree with that because it is the truth. Jay Seaton is Vice President, National Affairs for Apprising Financial Advocates and Consumer Credit Counseling Service, and he will explain how and where to begin to do all of that. Also, pediatric surgeon and Chief Community Relations and Diversity Officer at the Cleveland Clinic, Dr. Anthony Stallion, and former summer intern Jordan Kennedy will discuss the Cleveland Clinic High School Internship Program. Later on the broadcast today, Dr. Edgar Jackson of EBJ and Associates and Valencia White of the City of Cleveland Department of Public Health will talk about the city's lead prevention program. Good morning again. I'm Leon Bibb, and this is Kaleidoscope. And we begin with one of our regulars and a longtime friend, Jay Seaton, Vice President, National Affairs for Apprising Financial Advocates and Consumer Credit Counseling Service. Hey, Jay.
Hey, thanks for having me.
Oh, it's always good to have you here. And people out there, they're always trying to get their finances in order, especially during these tough economic times.
You know, your headline couldn't be more correct because as I think about it, no matter what time of the year it is, getting a handle on your money, you can do it at any time.
Getting a handle on it.
That's what I call it.
Well, we all know how to make money, but some of us don't know how to keep money.
There are 3 to 4 to 5 things that we could talk about that would help you keep it. One is, I always tell folks, you got to take the first step. Get organized. You've seen, and I want to say anything about yours and mine, but perhaps we're a little messy too.
Yeah.
You've seen some where people keep their personal financial information.
Yeah.
A lot of times it's a mess. You've got to take the first step and get it organized. It seems simple, it seems common sense, but if you don't take that step, you can't take the other steps.
Do you have a budget in your own?
Well,
I mean, you know how much you're going to bring home, and then you have a budget and say, this is what we're going to spend, this is what we're going to save.
It's funny because we didn't rehearse this, and we've talked about this before, but the B word, budget, just sends viewers off to the refrigerator. You know, they don't want to hear about that B word. So what I say is, instead of a budget, although yes, I do, I've got to practice what I preach. One of the things I suggest to people is after you get organized and the records are all where they need to be, then you need to take a look at what you're spending every month. So that's a precursor or a predecessor or the first step towards a budget. If I start talking about budget too early, as I say, people head for the hills. Find out what you're spending after you get organized.
Years ago, I had a friend, many years ago, I had a friend who got a new credit card. And he says, well, I got this new credit card. I guess I need to break it in and do something with it.
Break it in, huh?
It was burning a hole in his pocket. He says, I got to use it. I got to, it's gold, you see. And credit cards, we live on credit in America. Is that a good thing or a bad thing?
We do, and we've often talked about this because at some point I know you're going to bring out your card.
You know, you see me reaching in the old wallet.
I know you're going to do that. Having said that, remember, he's got to reach into his card just the way Leon's doing. You've got to reach in. It's plastic. It doesn't jump out of your purse or your wallet. You have to do it. Having said that, one of the things, if you want to build wealth and get financial security, after you get your records organized and then find out what your monthly expenses are, one of the things you want to do, if you use the credit card, remember, it doesn't use itself, you've got to do it. You've got to do what you can to pay more than the minimum payment. If all you're doing, I always think of the gerbil and running around that,
that wheel.
That wheel. Minimum payment fits that, unfortunately. You've got to pay more than the minimum payment. Then you can get ahead.
This little thing right here can get you on airplanes, can fly you to Hawaii,
rental cars,
take you wherever you want to go.
That's right.
But it can also get you in trouble if you don't pay off that debt.
Just remember, the thesis behind, or the idea behind credit is that, not debt, but credit, is that you're using something now that you're going to pay for later. Make sure you have enough dollars to potentially pay that bill, if not all of it, close to all of it, because otherwise that minimum payment, literally, if you want to build wealth, look for your retirement, college expenses, whatever you want to do, the minimum payment will not help you do that.
So you got to pay. You advise paying off the debt when you get the monthly bill. Pay it off.
If you can. I think it's 60 to 70% of the people do that, but that 30 to 40% who don't, pay as much as you can. If you can pay $10 more than the minimum, $20. One of the good things now is there are actual visual examples in the credit card bill. If you add more than the minimum, what does that mean for that bill?
If I bought a pair of shoes for $50 and they were on discount, they were on sale, and I bought a pair and used my credit card, and when the credit card bill comes and it says $50, if I pay that off, I've got my discount in those shoes. But if I
was
don't
talking
pay
to
it off,
one of your colleagues here at TV5 who used that very example prior to the show. That's
and if you don't pay
right.
it off, there's a carrying charge, a financial charge. I lost my discount.
Suddenly, that great price you got isn't so great.
Yeah. What's the number one thing that we should keep in mind? I've got a minute remaining. We should keep in mind when we try to talk about finances and we try to educate our teenagers, our kids.
One of the things that I really, and we had a conversation about that pre-air too, it's great because the subjects are so important. One of the things they should understand is that there is a difference between credit and debt. Credit is the ability to be able to spend and then pay later. Debt means you're digging yourself out of a hole. Understand the difference.
My father told me a long time ago, if you cut somebody's lawn and you make $1 or a couple of bucks, then keep 25 cents at least in your pocket.
I've had so many people tell me that they really appreciate your lawn cutting story because you've told it a number of times and it makes the point.
As I have always said, Dad told me keep a quarter now, and I still got that quarter in my pocket all these years later. And I was 11 years old cutting the lawn. All right. Well, let me put a phone number on the screen if we've not already done so. There it is, 800-355-2227. Apprizon.com. You can get more information. Our good friend Jay Seaton, Vice President, National Affairs for Apprizon, Financial Advocates and Consumer Credit Counseling Service. You have put money in our pocket and teaching us how to keep money in the pocket.
Thank you.
Thank you, Jay.
Thank you.
Always good to see you, my friend.
See you.
We'll have him back often, guaranteed. I've got to take a break. This is Kaleidoscope. You can find out what's coming up each week on Kaleidoscope by going to our website, newsnet5.com. Up next on this broadcast, how one local medical center is preparing the next generation for healthcare workers. Back in a moment. Thanks. Welcome back to Kaleidoscope. Good to have you with us. The Cleveland Clinic is helping to prepare students for careers in the healthcare field. Pediatric surgeon and Chief Community Relations and Diversity Officer, Dr. Anthony Stallion, is here, along with a Buckeye High School student, Jordan Kennedy. And they're going to talk about the Cleveland Clinic's summer internship program for high school students. Jordan was an intern at the Cleveland Clinic during the summer of 2011, and they will also explain how students can apply for the program. Good to have you with us, Dr. Anthony Stallion.
Well, thank you for having us.
You too, Jordan Kennedy.
Thank you.
So tell me about this. You're in charge of that internship program at Cleveland Clinic. Tell me what it does.
Well, the internship is run through our Office of Civic Education Initiatives, which is our office that works with our K through 12 initiatives around helping the kids to get real-world experience and learning experiences to really enhance their education and to really help them to pursue careers in STEM, so the science, technology, engineering, and math.
Kind of whets their appetites.
Yes.
For medicine and healthcare things like
Absolutely. And it gives them building blocks to really help supplement what they're doing in the classroom and really get that real world experience. And so with the summer internship, they're with us for 9 weeks. So we have over 150 interns during the summer who are with us for 9 weeks and are working about a 9-to-5 job and doing research projects across our health system and really getting a great experience.
With us is Jordan Kennedy. You're a senior at Buckeye High School in Medina.
Yes.
And you were in the summer internship program in 2011. How was that experience for you?
It was an amazing experience to be working with some of the best professionals in the healthcare profession. I mean, I got a wide variety of experiences. Not only did I get to view surgeries, but I also got to learn basic lab techniques, and I got to take these basic lab techniques back to my high school and experiment with them.
We're looking at some video of you right now walking along with some of the medical people over there at Cleveland Clinic. Dr. Charles Modlin, I recognize him right there. How would that experience give you hands-on?
Yes.
Does it propel you now into medicine? You think you'd like to go into medicine?
Yeah, it definitely increased it whet my appetite for medicine. Definitely working with Dr. Maudlin, I got to see some of the problems that are in healthcare today, and I got to even talk with patients by myself. So it was definitely a appetite-whetting experience.
Yeah, Dr. Stallion, you hear this from all your students. I'm imagining now.
Yes.
You hear this from all your students. You had a bunch of them in there.
Yes.
Do most of them go into the healthcare field?
Well, quite a few of them do, and it's an experience where they really get a chance to see if this is what they want to do. And there's so many different aspects of the healthcare field. So many of them want to go into medicine. They want to go into nursing, become physicians, sometimes allied health professionals. And so we really give them the opportunity to really try to pursue whatever avenue that interests them.
Somebody out there is saying, well, I got a student who may want to go into medicine or may want to go into the healthcare field in another aspect of it. How do they get in touch with the Cleveland Clinic to see if they can qualify for this internship?
Well, we now, with all of the internships that we have, so we have the summer internships, as well as we have multiple during the summer, as well as on the medical and even the administrative side, and then we also have opportunities during the school year as well. And so we actually have now launched a new advertisement and a website that allows them to go into the www.clevelandclinic.org and / civic education. And they're able to get that and access all of the information and applications for the different internships that we offer.
Yeah, and we've got that on the screen, so you parents or your students actually can write that down. clevelandclinic.org / civic education, and it'll get right to the internship office right there. This changed your life, didn't it, Jordan?
Yes, it did definitely change my life. It made me have a narrow focus on medicine. Before coming into the internship program, I wasn't sure if I actually wanted to do medicine or not, but getting experience in healthcare and working at the main campus Cleveland Clinic for 9 weeks definitely narrowed my focus into medicine.
Hanging out with Dr. Stallion, hanging out with Dr. Charles Maudlin, kind of, they're like mentors for you right now?
Yes, Dr. Maudlin has definitely been a mentor. Even after the program has ended, I still keep in contact with him, and he helps me pursue medicine since he's been there, and he knows what path to go on.
Yeah. Dr. Stallion, I got a minute remaining. Are there areas where for students who may not be, who want to go into the healthcare business, but may want to go into the business end of healthcare?
Absolutely.
Are there internships in that area as well?
Yes, we do. We have internships as well. So we have our young business leaders, and so we have programs in which they can get involved from that standpoint. We realize that, as we always say, that for every physician and research scientist, there are probably 16 to 18 individuals behind those individuals that allow us to be able to practice medicine. So those are the allied health, but also all of those that are on the administrative side as well. So we give that opportunity to individuals to be able to learn about the business aspect of medicine and hopefully pursue that as well.
We need people of all walks of life in our medical centers and in our doctors' offices, because they are businesses as well, and they've got to pay the bills and do all the other things that are done.
Right, and we think this is really important for our region and for us as a healthcare organization. I mean, as we look at things going forward and they continue to expand and grow, the need for talent is going to continue to grow, and so we need to be able to grow our own talent here in this region.
Jordan, leave us with a final thought on why you thought this was so important for you.
I think the internship program is important for me personally because looking at the healthcare profession and being there for 9 weeks, I realized that minorities are underrepresented in healthcare, and I think that me being part of this program has definitely propelled my interest, and I try to get other students to be involved in it and be involved in healthcare because that's one of the most important aspects of our lives.
In the next few years, we'd like to have you back on this broadcast and bring the MD behind your name when you come back. Oh, we'll have you back before that, but certainly, but we wish you well as you go toward your career, certainly in medicine. Thank you so much for being on the broadcast. We wish you well.
Thank you.
A senior in high school, but he already knows where he wants to go. Dr. Anthony Stallion, thank you for being on the broadcast as well. Good to see you, my friend.
Good seeing you.
Okay, I'm going to take a break, but I want to remind you that this is Kaleidoscope. I'll be right back in just a moment. You're in touch with Kaleidoscope, and we are glad you're in touch with us today. Education is the key to preventing lead poisoning in children. Dr. Edgar Jackson of EBJ and Associates and Deputy Project Director with the City of Cleveland Department of Public Health, Valencia White, are both here to talk more about the prevention and explain what they're doing to alert the public to the dangers of lead poisoning, certainly among children. Good to see you. My good friend Edgar Jackson, Dr. Edgar Jackson, and Valencia White. Let's talk a little bit about this problem of lead poisoning, and we'll start with you, Valencia.
Okay.
Where does the lead come from, and how can it possibly poison a child or an adult?
Lead comes from a variety of sources, which include the home environment, different occupations, and also the outdoor environment. So for an extensive list, you can go to www.healthyhomesac.org.
And we're talking about a lot of lead that's in old paint.
Exactly.
Any old house, any house that's got any years on it, any amount of years on it,
exactly,
there's lead in the paint, and when it chips, those little chips that we often see in the windowsill.
That's what creates the hazards for the toddlers between the ages of 0 and 6 years of age. When they're exploring their world, they're doing it through hand and mouth contact. So if they're by a windowsill or a doorway and that friction from that chipping and peeling paint goes on their toys or on the floor, it's going into their mouth.
They'll put it right in their mouth.
Exactly.
Dr. Jackson, what are the signs and symptoms of a child with lead poisoning?
Well, actually, there are very, very few, and they're quite subtle, but irritability, sometimes a child will show irritability, muscle aches, and once they get really toxic, if they get really poisoned, then they have an altered mental state. They may be quieter, more sedate, and even become unconscious if the lead level gets high enough. But our goal is to eliminate this before there are symptoms, because you really shouldn't ever get to where you're symptomatic.
So your organization, EBJ and Associates, Edgar B. Jackson and Associates, is working with the Cleveland Health Department in getting this information out.
Actually, I know I'm doing it more through my board position at the St. Luke's Foundation. I'm helping St. Luke's has funded.
You're wearing several hats when you do this, all of them in the medical profession. Yeah. How big a problem is this? Do we see this often?
Actually, yes, we do. A lot of people do not think that lead still exists, but it is in our older homes, as I said, and in the environment. So with some children, actually we had got statistics that in Cuyahoga County, our lead burden with children being poisoned is 4.1%, whereas on a state level or on a national level, it's 1%. So you can see that we have a heavier burden. In Cuyahoga County, in Cleveland.
So you're trying to get the information out, and you're asking people. Let's put a phone number and websites on the screen where people can get more information on what we're talking about. 263-5323, as you see in the 216 area code. Or you can go to clevelandhealth.org for more information on everything we're talking about, or go to healthyhomesac.org. What's that AC mean?
It's Advisory Council. It's the Healthy Homes Advisory Council.
Healthyhomesac.org on everything we've been talking about. What do you want the public to do now?
Well, we'd like for the families to ask for their children to be tested for lead. The national recommendations are to test at age 1, 2, and 3. If the child is not tested young, then, in those ages, then at least by 5 or 6, they should have 2 lead level.
Well, that's when they go to the doctor's office.
When they go to the doctor. So we're trying to sensitize our physicians to remember that, sensitize parents to ask for it. We should eliminate this as a problem.
Is this an easy,
entirely preventable?
This is an easy test? This test?
It's just a finger prick.
Just a finger prick, and they can look at the blood.
And they can look at the blood. And if it's greater than 10 micrograms per deciliter, then they would do a venous puncture to see exactly how bad the problem is.
What's your advice for people who live in a house that may be 20 or older years of age, and that's most of the houses out there?
Exactly.
And they've got chipping, lead is flaking off, say at the windowsill, right at eye level of a child. What do you tell them to do? Clean that up?
Yes, what we would advise parents to do is always make sure that their child is tested, like Dr. Edgar said, and make sure that their child always washes their hands, especially when they're coming in from outdoors, before they eat, or even before they take a nap. We want parents to clean the home weekly, especially paying attention to the window sills in their doorways, and provide the children with healthy diets that are rich in calcium, vitamin C, and iron.
You can pick this lead up also outside, right?
Exactly.
Just as easily.
Plain in the
Sadly,
yard.
just as easily. Dr. Jackson, Edgar Jackson, leave us with a final thought on why you're involved in this and why it's so important.
We need to save our children. We should eliminate lead poisoning entirely as a problem. It's easily preventable. Get the test when you go to the doctor, your child 1, 2, 3 years old, and eliminate this as a problem.
You and I have talked about the health care for years. You and I, very good friend, Edgar Jackson, and we've talked about this, and this is one way that we can raise our children in a way stronger way.
Absolutely. 1 in 20 of our children in Calhoun County have an elevated lead level, and it can impair their ability to learn. It can impair a lot of problems.
So it has long-term effects.
Exactly.
Yes, we get this solved.
And it's 100% preventable.
And it's preventable.
So that's why we're getting the word out.
Thank you for coming on and giving us information. Edgar Jackson, Dr. Edgar Jackson, and Valencia White, thanks so much for being on.
It's a pleasure.
Yes,
Thank you.
Appreciate it. I'm going to take a break. This is Kaleidoscope. I'll be right back after this. One of our partners on this broadcast is the Urban League of Greater Cleveland, and with me is Kim Johnson. She's a board member working in her 3rd year with the Urban League of Greater Cleveland. Good to see you, Kim.
Nice to see you as well.
How are things going for you at the Urban League, and how's the league going?
Things are going really well. We are very, very busy, committed to bringing great programs and resources to the greater Cleveland community.
Yeah, I know Marsha Maccabee's guy has been at the helm for a couple of years now and apparently doing a wonderful job. What are some of the issues that we have to deal with, that you have to deal with here in the greater Cleveland area on the Urban League board?
Well, the Urban League board members are concerned about meeting the needs of the people in the community. So we are going into the high schools, dealing with our career beginners, workforce development. We're working with businesses and corporations and foundations to meet the needs of our entrepreneurs through our Entrepreneur Center, and just making sure that we have relevant resources available to meet the needs of the people.
This has been the long-term goal of the Urban League ever since it began about 100 years ago or thereabouts.
Absolutely. Absolutely, nationwide.
What do you enjoy about it? This is your 3rd year as being on the board. You are in the real estate business with Keller Williams Realty, the greater Cleveland Southeast area, a broker. But when you work with the Urban League, what keeps you tied to the Urban League? Why?
What keeps me tied is their heart for the community itself. I was a student who participated in some of the programs that were offered by the Urban League. Marsha Maccabee led a program called Career Beginnings, and I was a student at Shaw High School who actually participated in that program. And as a result of some of the training and exposure that I personally received, I became the first person to graduate from college in my entire family. So I'm very passionate about my support of the Urban League and the work that it does by actually touching the hearts and lives of the people in the community.
Certainly the Urban League has done that, and you have done that as well, being a member of the board. So many thanks, Kim Johnson, for being on the broadcast with us.
Thank you. I appreciate it.
That's going to take it. We'll both say so long.
Kaleidoscope, a weekly public affairs program brought to you in partnership with the Urban League of Greater Cleveland, Kaleidoscope Magazine, and News Channel 5.